14 Components of Basic Nursing Care by Shelley George. Virginia Henderson was born on March 19, 1897 in Kansas City, Missouri. She spent her career as a nurse, teacher, author, and researcher. She made significant contributions to the field of nursing. Her interest began during World War I, and her desire to help the wounded in the military and her career blossomed from there. She eventually went back to school for her bachelor's and then for her master's of arts degrees in nursing education. She taught nursing at Yale University. Throughout her career, she had many accomplishments. She was awarded 12 honorary doctoral degrees as well as the International Council of Nursing's prestigious Christian Men Prize during the exemplary career. She is also known as the 20th century Florence Nightingale. Virginia Henderson is known for the need theory. The nurse cares for the patient until they are able to take care of them for themselves and allows patients to be more independent in their care. This need theory focuses on the 14 basic human needs of the patient. Henderson believes a patient is an individual in need of nursing care. The patient is also sum of parts with biopsychosocial needs. Therefore, she advises nurses to always act independently to assist patients regain their health or die a peaceful death. To her, a person achieves wholeness by maintaining physiological and emotional balance. It is clear to Henderson that people get faced with health needs, which make them weak and dependent. The concept of environment, Henderson believes that external conditions affect life. The environment is viewed as a critical component in patients' well-being. It is basic needs that are essential for health, requiring assistance to achieve health and independence or a peaceful death. The environment plays a big part in providing a safe place for the client or patient to heal. Henderson explains that the environment has many components where a person can live in many different ways. Concepts of health. Henderson did not explicitly define the term health. She believes that for a patient to achieve health, then there should be balance in the 14 components of human life. Henderson states that health is related to the ability to achieve independence without any aid in the 14 components of human needs. And this relates back to the person needing to be independent. The 14 components of human needs was created by Henderson. Henderson believes that have to have good health can be a challenge because there are so many factors affecting it. The nursing concept. Henderson says the nurse is a substitute, supplementary, and complementary with the patient. She also believes that nursing is supposed to assist the patient to gain independence within and out of the hospital. Henderson's need theory emphasizes the importance of patient independence so that the patient will continue to progress after being released from the hospital. She also felt the role of the nurse to be a helper to the patient or a partner in care. Nurses are tasked with executing roles that benefit the patient. Some of these roles would be helping the patient and working with them so they are able to achieve independence. The needs of the patient are closely related to their health, and the needs the nurse must meet to improve the health of the patient. She also believes the environment is composed of all the external conditions and influences affecting the life and development of the individual. Some assumptions of Virginia Henderson's need theory is nurses care for patients until they can care for themselves once again, maintaining that independence. Patients should have the desire to return to good health and well-being so that they can become more independent, and the nurse can help with this. The nurse should always be willing to serve, and that the nurse will devote themselves to the patient day and night. Henderson also believes that the mind and body are inseparable and are interrelated. Nurses must collaborate within an interdisciplinary team and become independent professionally from the physician. Some propositions of Henderson's need theory. Religion is believed to anchor health in terms of peace. It can offer stress relief. Individuals are advised to communicate and share with others their needs, fears, emotions, and opinions. Sanitation-related diseases are many and easily prevented and controlled through proper cleanliness. Some also are asleep and well-rested individuals are deemed to be healthy. And again, with religion, people that worship according to their religious beliefs can consider to be healthy as well. Some limitations of the need theory. The relationship among the 14 components of the need theory are unclear. The theory does not show the interrelationship between factors and the influence of the nursing field. There is a lack of conceptual linkage between physiological and other human characteristics. The theory also has no concept of the holistic nature of human beings. The need theory was founded by Virginia Henderson to help explore the nursing practice. Virginia Henderson emphasizes the importance of increasing the patient's independence and focus on the basic human needs. This is so that patients can progress after they leave the hospital, maintaining that independence. Using her basic needs theory and its 14 concepts is beneficial in the nursing practice because it's very adaptable and allows for the nurse to reflect on their competency when helping maintain a person's health. Creativity is urged when caring for a patient for better quality of care. The need theory is crucial in helping the practice of nursing achieve optimal patient outcomes. The need theory helps to set goals that help the nurse measure the treatment of their patients. Evaluation of the need theory depicts its applicability in nursing education since it explains the functions of the nurse professionals in their work environment. Applying the need theory in the education of a nurse increases the awareness of the interrelationship between the body and the mind, which informs the nursing process. The need theory provides basic guidelines that nurses should use in their day-to-day interactions with patients. The need theory is a foundation for the development of better approaches that help change or guide the profession in the current setting. The need theory also provides a baseline that can be used in making clinical decisions. The need theory is very easily understandable and covers a broad range of nursing. The need theory can be applied in my current practice to improve therapeutic communication between my patients and I. My practice demands knowledge on how to handle the in-person environment and health, which are vital particles of Henderson's need theory. Applying the need theory informs on the best approaches to handle the psychological, moral, and spiritual aspects of the patient. This theory is applicable within the setting since meeting patient needs in areas of respiration, nutrition, elimination, body mechanics, rest, sleep, keeping clean and well-groomed, controlling the environment, communication, human relations, work, play, and worship. As these will be advanced nursing care areas that I will need to promote for my patients' basic needs. Working in a hospital that serves many different backgrounds and cultures, the role of the nurse is critical in giving proper care while the patients achieve the goals set out for them and have the best care possible. When applied, the need theory provides a clear plane of care where the focus of the patient's health and well-being. The purpose is to emphasize the importance of increasing patients' independence. Some say that Maslow's hierarchy of needs was the reference to her theory, as the needs are somewhat similar of what actions or roles one may be or need assistance within order for independence and well-being. Henderson was a proponent for nurses and to be independent, but not to have full practice independence, as she thought this was for the physician. I hope you all enjoyed listening to my presentation of Virginia Henderson's need theory. Thank you.